Welcome, dear friends. This is Dr. Jaitly, your cardiologist from New York, on your favorite video site, MuniSTHealth, which is being shown on several social platforms, mainly to enhance medical education and patient education in order to improve the clinical outcomes. And that has been clearly shown beyond doubt that clinical outcomes, clinical results actually are much, much better. The cardiovascular benefits are huge, especially the patient has improved health literacy, and of course in the presence of good medical education to back up with the physicians he or she is seeking the treatment from. So without any further ado, I'd like to again welcome you to MuniSTHealth, your favorite video site, and just a few housekeeping rules. I want to put them aside. If you're experiencing an emergency, please dial 911 and get to the nearest hospital if you're in the United States, or if you're outside of the United States, obviously call for the nearest hospital, call for the doctor who is nearest by, etc., etc. Okay. 2, for my medical students and residents and fellows, this is not a syllabus substitute. Please make a note of it. It's only a supplement. I always emphasize on that. So always complement that with your syllabi that has been prescribed to you by the universities and by your colleges and societies. Number 3, it's an educational channel and only an information channel, not a treatment advice. So without any further ado, let's delve into the subject matter quickly. And this short video vignette is only going to be explaining the mechanism of OSA, which is called obstructive sleep apnea. Now, what do we understand by OSA? These are apneic spells that are basically characterizing the obstructive sleep apnea in a setting where patients start to hyperventilate initially, followed later by a huge apneic spell, and then there is again a hyperventilation, as you see here in my schematic. So this is the phase where the respiration rate is going up. It's almost zero, if you will, and therefore this is apnea, and alternating later on again by hypercapnia. So essentially what is happening is, this is, by the way, it's a normal phenomenon, but the fact is that in OSA it is characterized by hyperactivity of the same, or exaggeration of the same phenomenon. So, and it's whether or not it is coexisting with obesity as a cause or effect, we do not know, or is it using the same etiopathogenesis, because most commonly we are seen with in obese patients an obstructive sleep apnea to exist. However, it may be also present in patients who have hypertension. It is also present in patients who have diabetes, and of course who have coronary artery disease. So these are the comorbidities, cardiovascular comorbidities, that do exist in patients who have OSA. What is the mechanism? Well, the mechanism is when somebody is hyperventilating, obviously the PCO2 is going down and the oxygenation is getting better. But that is and there are numerous pH, or what you call the acid-alkaline balance disturbances that can occur, and they trigger off the chemical response. So let's understand what a chemoreceptor activity here is first. Oxygen deficiency occurs during the time when the apnea has occurred, and the PCO2 levels will start rising. Okay, so the PO2 levels have gone down, PCO2 levels are gone up because the person has stopped breathing for a few seconds, and that is signaled via the bloodstream into the chemical centers situated in the brain. Remember, these are in the brain, and here, this is where the trigger occurs. So the chemical centers which will send the signal to your intercostal muscles and therefore to the respiratory centers, etc., which will now trigger a hyperventilatory response. And as a result, now the oxygen suddenly starts coming back into the lungs because you're hyperventilating, and therefore into the bloodstream, and the CO2 is being washed out. So the pH is again being restored, and the oxygen deficiency has been removed, and the hypercapnia is corrected. Correct? Hypercapnia is high CO2, which was here, and oxygen deficiency that was here, that is being corrected by hyperventilation. Again, the cycle repeats here to form, because this will trigger again an apnea, because it will go back to the chemical centers with high oxygen and low CO2, and the chemical centers will say, okay, you can stop breathing for a few seconds until we correct it again. So this is the phenomenon that's happening. The respiration rate is going up, is dropping. There is an apneic spell, is increasing and dropping again. So this is the respiration rate that's happening as a result of a chemical center response, or chemoreceptor activity, we call it. This is in the simplest form I'm trying to explain to you. Next is the baroreceptor activity. Let's go to the left side of the panel. The baroreceptor activity is the following. The baroreceptors are situated in the peripheral vessels, if you will. So when they're situated in the peripheral vessels, they will draw the vessel here, for instance, okay? And it's my favorite schematic here. You can show some plaques here if you like, because most of these patients, they're adults. They have too many cardiometabolic syndrome risk factors, including hypertension, diabetes, and high cholesterol. And of course, obesity to go along with it. On top of that, you can throw in smoking as a risk factor. You have all the risk factors together then. And obesity normally and hypertension again go with the family history, so you have the fifth risk factor as well. So when these arteries where you have peripheral vessels, where you have the baroreceptors now situated in these peripheral vessels, they get a signal that the heart rate is going down, or the blood pressure is going down, and the peripheral vascular resistance is going down. Immediately they will send signals to the carotid bodies, which are situated obviously in your carotid system, and the carotids are obviously in the neck. So you have, we'll draw the carotids here like that, and of course you have a common carotid here, and then you have a common carotid here. So these are your two carotids. This is the right and the left, and the carotid receptors are situated right at the junction where the common carotid bulb, rather, where the bulb is situated, where the where the internal carotid and the external carotid, they actually bifurcate. So the bulb is right there, and this is where the receptors are. So these receptors, they will get the signals, and they will in turn signal to the sympathetic nervous system and the parasympathetic nervous system, because they are constantly sending signals to these two to keep in balance. We know sympathetic system is obviously going to send the heart rate to go up, and parasympathetic system will send it down. So what do the carotid receptors here do? They will suppress the vagal centers, or the parasympathetic nervous chain, and stimulate the sympathetic nervous system, resulting into increasing heart rate. So now the heart rate starts increasing, resulting into increasing blood pressure, and resulting into increasing peripheral vascular resistance. So all of this will increase. And this is the phenomenon that occurs during the time of hyperventilation. Followed later by these signals again, all of these signals will result into apnea. So the apnea occurs as a result of increased blood pressure, increased heart rate, and increased peripheral vascular resistance. So it is a negative feedback mechanism that is being described in physiology, except that this is taking place in the obstructive sleep apnea episodes in patients who have an exaggerated response, whether or not it's related to obesity or obstruction in the upper airways. Now we know that obstructive sleep apnea patients have an obstruction in the inflow mechanisms of during the time, even despite that they are trying to hyperventilate. They will have some inflow obstructive patterns, whether it's because of the adenoids, whether it's because of the tonsils, whether it's because of the neck tissue in obese patients, or what have you. But the fact is that that mechanism also is playing a role, and many times that's why the devices have developed. We're not going to discuss the devices here. We're just going to talk about the mechanisms and the various pathophysiological responses that are occurring during the OSA cycles. Third, we go to the inflammatory response. We know that the CRP, which is a long well-known chemical marker in the blood, that's called the C-reactive protein, that goes up. We also now know that the tumor necrosis factor alpha also goes up. We also know now that the interleukin level 6, interleukin 6 also goes up. So these are your inflammatory markers: CRP, TNF alpha, IL-6. Oxidative stress response is the next mechanism that occurs, which will result into free radicals that will start to develop as free radicals of oxygen. There will be also superoxides, if you will, and these superoxides, they are from the neutrophils, which are being produced as a result in OSA. And thirdly, there will be diacron oxygen radicals. So there are different mechanisms where these oxidative stress response during the OSA occur. Hypercoagulative states are classically where the fibrinogen levels are known to increase. The platelet aggregation actually increases also in these patients, and there will be changes in the TPA, the tissue plasminogen activator. There will be changes during the constant cycles of hyperventilation and hypoventilation. So there are hypercoagulative states, and then factor 7 has been defined as another factor which tends to go up during the OSA cycles. In other words, obstructive sleep apnea cycles in patients who are extremely prone or are having OSA. So in a nutshell, you've learned the baroreceptor activity, you've learned the chemoreceptor activity through the chemical centers, how the oxygen deficiency and the hypercapnia result into hyperventilation, followed later by apnea, and the cycle continues. Here, the baroreceptor activity is showing the heart rate and blood pressure and peripheral vascular resistance decreasing as a result of apnea, and resulting into stimulation to the carotid bodies, which will send signals to the sympathetic chains and the parasympathetic chains, resulting into hyperventilation and therefore correction of the blood pressure and the peripheral vascular resistance, and so also the heart rate. So this is the baroreceptor activity. We talked about the inflammatory activity, where the CRP and TNF alpha and interleukins, they are all elevated, so that's good to remember. Oxidative stress response is very clear, where the free radicals, we know these are very, very hurtful to the cells, and in fact they could be inflammatory and the oxidative response, these two together, I should say, they could be responsible for the endothelial dysfunction, which we will talk about in a different video, I believe, in my different chapter. But I would like to say that the free radicals and the inflammatory response, they are also responsible for the endothelial response that occurs within the vessels here or throughout the body. Hypercoagulable states, as we just talked about, are these: the fibrinogen levels, the TPA, and of course the platelet aggregation and factor 7. So in a nutshell, you've learned the mechanisms of OSA. I thank you for your attention. So stay tuned for more OSA coming down the line in the next videos as well. And stay well, stay healthy, and stay heart healthy. And that's my goal. And stay with MuniSTHealth. And please do click your subscribe button and of course the like button. And do write your comments, suggestions, and questions. I'll make it a point to answer those within 24 hours. Thank you again for watching MuniSTHealth. So long. This is